So the available graft today is xenograft, allografts, and autografts and synthetic. If you see in the xenograft, you have a bovine collagen, and in allograft you have fasciolata. Autograft, again biceps and fasciolata, and synthetic it's polyester patch. So what are the important characteristics of the patch? It's very important to know before putting a patch about characteristics of the patch. It's a highly mechanical, resistant, able to have a excellent suture retention, attach firmly to the bone, slow degradation or no degradation, non-toxic, biocompatible, bioconductive, bioinductive. It's been very nicely described by Snyder in 2018. So also we need to know the characteristics of the patch is mechanical and biological. Mechanical, what I've written on the left, and biological on my right. So if you see this study by Watson from 1990 to 2015, there are so many studies being done on a rotatory cuff tear with augmentation versus no augmentation. If you see the blue line going up, from 1990 to 2015, which goes dynamically up, so many studies. But if you see the three lines on the top, the horizontal lines, those lines are being static from 1995 to 2015. That is the function, retear rate, and outcome. That's not been changed since last 15 years, from 1990 to 2015. We understand since last 20 years, we've been seeing a great mechanical work happening in the cuff, but what is really lacking is biology. One need to know the Rohi score to understand what is the cuff healing and what is the cuff tear. Rohi score is very, very important. It's on the age, size of the tear, retraction, infra-atrophy, and BMD. If the Rohi score is 2, then your tear rate after fixation is 12%. If your score is 5, then 30, 10 is 72, 15 is almost 100%. If you see the down, if your score is 0 to 4, then your healing rate is 94%. It goes to 10 to 15, then it's 14%. So there is some more literature. In 2019, Belly has published its systemic review, which clearly says that there is a less retear rate after fixing augmentation on the repaired tendon. Again, 2022, some more studies included, shows the results benefit from patch augmentation and rotatory cuff repair, particularly reduction of the retear rate. So what are the patches available today in India? The patches which is available are synthetic patches or biological patches. The synthetic patch is made by polyester patch, which is kept on the repaired cuff and suture on it. What does the literature says? The literature says the synthetic patches are more mechanically strong patches, but they are not biological. There is another study says synthetic patches are more better than the biological patches. It is more stronger, more stiffer. Then comes to a collagen bioinductive implants, which is a woe in India since last 2 years. What exactly happened in biological inductive implants is it disappears in a 6 months time, and it becomes a thick tendon on the repaired tendon. These are some of the evidence post bioinductive implants on the partial thickness tears, post 12 months on my left, on the right full thickness tears by fixing supraspinatus, on that the patch, and shows a good amount of tissue formation after 12 months. There is another study shows that bursal side tears. You can very well put this bioinductive implants without fixation, and you see the results, what this study shows after 3 months. This is one of my case where it is a police cop by profession, 31 years male, who came to me with shoulder pain since last 4 years. Left shoulder pain, had a 10 years back fracture, humerus fracture, underwent a nail somewhere else, and removed this nail after 6 years. Since 4 years, he got a pain in the shoulder and little stiffness in the shoulder. We had done X-ray, MRI, shows there is a mild tear in the GT level where they have removed the nail, and there is a small interstitial tear in the supraspinatus. I went inside, I have seen there is a diffuse tendinosis over the supraspinatus. There is a small partial tear. So I've just kept bioinductive implant on it. 9 months down the line, we need to take an MRI after 1 year. I have not still taken an MRI. This other case, 58-year-old female with a supraspinatus tear, complete. So after complete releases, it is coming to the footprint, and I've done a double row fixation and bioinductive implant on it. So the other side, there are dermal allografts are coming to India. They're launching next month. The dermis is not a tendon, and it has a good healing rate, more mechanical solutions. There is a study come in 2024 November, says dermal patches have a better outcome, but they again take the Rohi score. If the Rohi score post fixation less than 7, augment. If the Rohi score more than 7, if the Rohi score less than 7, don't augment. More than 7, augment. The other side, autografts, biceps patches. Just now we have seen Mr. Ayappan being demonstrated about biceps patches. This is a biceps smash by Arthrex. There is some controversies why biceps has to be smashed and keep on the repaired tendon. Tonish has made a recent publication, shows good results. There are different patches available today in India. Bioinductive by Smith & F, BioBrace, this is the both mechanical and biological brace available at the moment, and pitch patch from Xeros and Orthoflex by Arthrex. The fact of these patches, we don't know where we currently, we don't know where we stand currently. There are some weaknesses, there are some pluses. There is no clear indication so far. So we need to wait and watch for the, some more studies. They're all short term. The conclusion is augmentation of the rotator cuff pathology offers a great promise. Patches and grafts may play a role. Studies are needed to define indication best graft sources. Consideration of cost, ease of use, effectiveness desperately needed. Lastly, be open-minded, but not so open-minded that your brain falls out. Thanks for your attention, and best of luck for the rest of your sessions.